My name is Dr. Vishal Ganesh, and I'm an orthopedic surgeon in Phoenix, Arizona. I was born in Toronto, Canada. Growing up in southern Alberta, I played a lot of hockey. I had a few doctors in my family. I had a cardiothoracic surgeon for an uncle who lived with us and was the primary reason I got into medicine. I completed my orthopedic residency in Michigan, in Detroit, and then did a fellowship in Minnesota, and then came to Phoenix where I started my practice. The American model allowed me a greater degree of diversity in the procedures that I could perform, as well as the ability to make decisions that were best for the patients. For example, the direct anterior approach to hip replacement, which is a newer, minimally invasive technique, is being used more commonly here in the United States. However, worldwide, the older techniques are still being used. And while all the techniques are effective, certainly the patient experience is much better with the anterior approach, with less pain and a quicker recovery time. A joint replacement surgery is one of the most common operations done worldwide. It's a very common problem to have arthritis in the joints. The outcomes from these operations have become absolutely excellent based on a number of different techniques that have changed over the years. Additionally, the implants have become very durable and long-lasting. So one of the great advantages of our model is that we're using state-of-the-art technology and state-of-the-art implants. These implants have longevity much greater than we've ever had before, and increases the likelihood that you'll never have to have this procedure done again. The state-of-the-art implants are often only available here in the United States. For many of our Canadian patients, one of the greatest advantages of coming to Phoenix Spine and Joint is the longevity of our implants. While the surgery may be done in Canada, it may have to be redone at some point in time, whereas when we perform this operation, we expect it to last you a lifetime. I want my patients to enjoy normal activities after these joint replacements and carry these out throughout the rest of their lives. Taking walks, going for hikes, going traveling. These are all advantages of having the joint replacement that lasts you throughout your life. In the Phoenix Spine and Joint model, the patient receives very tailored care and very close attention throughout the entire process, from first contacting us to feeling fully recovered. This is a very patient-centric model that we use. The complication rate from total joint replacement surgery is quite low, and certainly it's a very common situation where a patient has their joint replaced and says to me afterwards they wish they hadn't waited as long as they had because it changed their life in such a dramatic way. When patients contact Phoenix Spine and Joint, we arrange for a secure teleconference where you talk to me directly. You tell me about your joints, you tell me about your pain, you tell me about how they limit your life. And I will listen to your problems associated with your knee or your hip, and then we discuss the treatment options that might be available to you. In some cases, patients have pain in their joints that do not require joint replacement. However, in patients who have advanced arthritis and require some type of surgery to correct this, the process is started here at Phoenix Spine and Joint, where imaging is reviewed, health history is reviewed, and decisions are made by you and me together about what is best for you. Nobody should have to spend time suffering when treatment is available that can help you improve your life. At Phoenix Spine and Joint, our philosophy is patient first. Safety is paramount. At our center, we've created a process that allows patients to receive the best care with the best implants to have the best outcome. For Canadian patients who are living in pain, Phoenix Spine and Joint will be an excellent option. Although medical tourism often gives patients a lot of anxiety coming to another country to undergo a major operation, my confidence in your outcomes is based in my previous outcomes. The fact that patients do as well as they do give me confidence that I can offer you the same result.